There are various note types that will be quite helpful to you during your rotation here at Children's. The first is the trauma H&P. This can be found by selecting Provider Note, heading to the General Surgery folder. So drop all the way down to General Surgery, click General Surgery, and you'll find that there are a number of variations. The one that you want is the trauma H and P. Click that note type, press OK, and you can start documenting. It's important to note that there are a number of fields that are populated and must be complete before documentation can be saved. You'll see one of these categories is MedRec. It's important to ask the family or caregiver if the patient takes medications, and if so, the name of the medication, the dose, the frequency, so that you'll enter into the medical record and click that MedRec has been done. You'll see the next sections include past medical history, and then finally a physical exam, where again, one can document pertinent physical findings. It's important to note that the plus sign allows you to document further laterality and any positive or negative physical findings. And again, there can be an indication that a physical exam finding is within normal limits, or there are ways to elaborate upon your physical findings. Here you'll find that lab results can populate in. However, you'll need to cut and paste radiology results into the medical record as they're resulted. Importantly, we want to emphasize that there is a place in the medical record here in this note type where you as the provider can type your impression of the patient, results of the primary and secondary survey, as well as the plan. Most importantly, we want you to document thoroughly the plan. Here we have included basic trauma labs as an option, comprehensive trauma labs, the patient's diet, whether further imaging is ordered or needs to be ordered, pertinent consults, pain control plan, a VTE risk assessment, which needs to be documented on every trauma patient, and then the plan for admission. We also have a reminder here that a tertiary survey needs to be completed prior to disposition, so that can be documented in one's plan as well. And then finally, that either the surgery fellow was present for the resuscitation, the attending was present for the resuscitation, or notified within an hour and in agreement with plan, and that's in regards to the surgical attending notification. So again, instead of using free text, click on the impression in plan to document all of the below. The note will then be signed and sent to the surgeon on duty. It can also be saved to finish at any time. When selecting labs as part of the plan, important to note that UA is an option, as well as basic trauma labs and comprehensive trauma labs. Just wanted to clarify that the basic trauma labs do include hemoglobin, ALT, AST, and UA. Cervical spine clearance note under type, the title, cervical spine clearance. You'll look at the child's age. If greater than 2, assess GCS, full range of motion, including neck flexion, extension, and bidirectional rotation on command, a normal neurologic exam, no distracting injuries, no evidence of intoxication, no cervical tenderness on palpation, and no step-offs nor deformities. If unable to clinically clear the cervical spine, order a lateral C-spine and proceed down the C-spine clearance algorithm in the trauma app. Progress note, the note type, again, is found in the general surgery folder, listed alphabetically in the folder categories. Which can be expanded by clicking. Trauma burn progress note, and it's fine to relabel this note tertiary survey. Tertiary surveys are to be completed within 24 hours of the patient's presentation to the hospital. Should include a summary statement, should also include a full physical exam. If a cervical spine is cleared, use the C-spine clearance note. All labs that have been ordered are to be resulted. And imaging studies should all have final reads. Once these components are complete, document whether further injury was identified. And elaborate on the patient's plan of care. Send to the surgeon of the day for signature.